Thank you so much, Dr. Chris Atherton. What I'm going to do is, if you haven't noticed, session number 3 is actually a fairly long session. So we've broken it up into different chunks. We're going to give a question and answer opportunity for the forum members and for the audience to both Dr. Harris and Dr. Chris Atherton, and then after that we're going to move on to the muscular and skeletal systems. What I'm going to ask is, before you ask your question, please, when you step up to the microphone, if you can identify yourself. And if you haven't noticed, we actually have 2 microphones, one on either side of the room, so you don't actually have to crawl across each other to get to the microphone. Please.
Hi, thank you both for your talks. My name is Hadia Green Guerrero of the American Physical Therapy Association. And I was just thinking, as you were talking about the standards that we have for high blood pressure or hypertension, and that we don't expect an infant or a small child to have the same heart rate or tension in their blood vessels that we do in an older person or an aging person. And it seems natural to me that as they get older, just like our muscles and other tissues stiffen, that your tension would therefore follow in the same realm. And why do we have, or do you, if you could control from that, would you see a difference in these plots that we've looked at today if we set our standards different for elderly? So because we're calling people sick or at risk, that might just be, like you said, a natural cause.
I'll take a crack at it, and then Penny. So first, although it's usual for people to develop hypertension, it's not normal. There are populations that have been shown to not develop hypertension as they get older. There are people who are likely genetically blessed who don't develop hypertension, but there have been studies of people, for instance, who are institutionalized, and they tend not to develop hypertension as they get older, or populations that were rurally isolated, and they didn't develop hypertension as they got older until they moved to an urban environment. It's not, I think that the first point is that we know that it's a relatively pathologic process, and we also know that it's associated with an increased risk of cardiac outcomes. I think that there are different standards for blood pressure in different subgroups of the population. I'm not sure that I addressed your question, so, okay.
And I think when you look at the blood pressure recommendations, the most current ones from JNC 8 are really controversial. And it's my understanding that because of the SPRINT trial, these are being reviewed, and there may be some new guidelines that come out real soon. So stay tuned.
I also want to say that, we're seeing the first, the first generations of people who've had their blood pressure treated are now entering old age. And I think that it's going to be very interesting to see what happens to the incidence of cardiovascular disease as that population moves into old age. And I don't know about you, but I do take blood pressure medication, and nobody is taking it away from me when I turn 70.
Penny, I want to thank you for your presentation and also for your challenge to all of us to begin addressing these chronic disease problems in children. So I would like to ask you, from the point of view of a diet intervention, since we know it's very difficult for a child to change many things at the same time, what would be the one most important diet change you would suggest in order to reduce the risk of cardiovascular disease in children?
Okay, that's a real good question, and I would love to hear everybody else's responses too. But I think that we could do a lot if we just get kids to start eating more fruits and vegetables. And I think that in and of itself, can really improve diet quality. It may, provide satiety because of the low energy density. It's a form of, it's a food form of potassium that might help, lower blood pressure, and they may substitute, a lot of solid fats and added sugars, including saturated fats, with healthy fruits and vegetables. So I think if we could just do that, that would be something real positive.
Thank you both for excellent presentations. I guess I'll echo Dr. King's question and ask about medicated hypertensives over 75. What specific dietary recommendation would you suggest as an intervention?
Well, I would recommend, what American Heart Association recommends. I still think we need to really control sodium, because it's clear that increasing sodium increases blood pressure. Increasing blood pressure increases risk of heart disease and stroke. So I'd focus on sodium, but also the rest of the diet. Follow a diet that's lower in saturated fat, and then meet all current food-based recommendations.
So we have time for one more question. I believe we have a question from the side.
Thank you. My name is Krista Scott. I work at Child Care Aware of America, and I'm actually working on the early childhood side of the fence. And my question is actually about thinking about this continuum from childhood to late adulthood and the old. The one common thing between us is the child and adult food care program. And recently there were meal modifications, but I'm wondering if maybe you can comment on the child and adult food program's influence and impact in older adults. I certainly know how it impacts the birth to 5 side where I am, but I'm wondering if you could speak to that on the other end of the continuum so I can connect that better. Thank you.
Okay. I don't really know too much about that. Well, I think that because we have federally issued dietary guidelines, I think that any program that receives any federal fund should be obliged to follow those. And what harm is there, in providing a healthy diet that meets current dietary recommendations? And I think everybody's going to benefit from that.
I wish we had a better answer for you, but we did a quick confab, and neither of us really had a good answer.
That's okay.
All right.
Maybe there's an opportunity to connect, and that's great.
Yeah, thank you.
Thank you so much,
Thank you.
Dr.
I'm so
Atherton,
sorry.
for emphasizing the importance of added sugar, especially in the preschool and school-age children. I have a question regarding LDL and HDL. And very importantly, you did indicate how significant they are with respect to the cardiovascular health. What about the ratio of LDL over HDL over LDL? What if the HDL is very high and at the same time LDL it is high, but the ratio is above 1? Because based on some studies, I have sort of established in my mind that that is it is a very good indicator and preventive against cardiovascular disease. Thank you.
So, Doctor, I want to thank you for your question. I'm going to ask our panelists to keep the answer short so we can keep moving with the program.
We were going to suggest that we discuss it offline because it was a very good question. And,
Okay.
Yeah.
And
Okay,
just
very
a
good.
real short answer is that current treatment guidelines target LDL. So that's what you really should be looking at is LDL. And also, National Lipid Association targets non-HDL, all of the bad cholesterol,
That is regardless the ratio.
regardless of the ratio.
Okay, thank you so much. That was a very good discussion. We appreciate it.